Hello, and welcome to the Healthy Department podcast, brought to you by the Greenup County Health Department. My name is Andrea, and I'm your host. I'm a registered dietitian here at GCHD. This podcast was created to give our community a closer look at who we are, what we do, and why public health matters. Here at the Greenup County Health Department, we are passionate about protecting and improving the health of our community, not just in the clinic, but wherever people live, work, and gather. In each episode, we'll talk with members of our team and community partners about the programs, services, and stories that shape public health here in Greenup County. For our first episode, I'm very excited to welcome Cassie Mace, a health educator and registered nurse here at the Health Department who's been with us for 23 years. She has seen a lot of change over the years and brings a wealth of experience and perspective. Today, we're going to talk about the past and present of GCHD, where we've been, how we've grown, and how the work we continue to do supports a healthier Greenup County. So let's get started.
Greenup County Health Department. Our legacy of health lives on. Greenup County Health Department. Public health is public wealth.
So Cassie, tell me about when you first joined the health department here 23 years ago. What was public health like then? What do you remember most about the early days?
When I started the health department, I was fresh out of college and I had this newly minted biology degree. And what really struck me was how many areas that public health encompassed. You know, like many people, when I was a kid, I came here to the health department for the odd vaccine, and I knew about septic tank installation, water testing, things that we had experienced over time. But there were so many programs that were new to me. And even 23 years in, I'm still learning more every day. Like when I first started working, I felt like this sponge and I absorbed everything I could. And no matter what program you worked in, if people found out that you worked at the health department, they had a question. Mm-hmm. And I committed myself to learning as much as I could about each program so I could help the citizens of Greenup County. And one thing that it's really become apparent to me was that in the early 2000s, we didn't have much in the way of technology. We depended on fax machines to share information, and most people didn't have access to computers in their homes. And Facebook and other forms of social media did not exist or were in the very early stages. And we had to memorize so much information because it wasn't readily available online, because there wasn't an online repository of such things.
Mm-hmm. Yeah, and I think it's interesting that you mentioned how when you first came here, you knew how we did certain services, septic tank installation and checks, that kind of thing. When I first started here, I also didn't know all the services like WIC and HANDS, those types of things that are offered here, because at every health department, you know, they don't, not necessarily every health department in the state of Kentucky or other states offer services such as WIC and HANDS. So it's interesting to see, you know, how many services we have here at the health department. So 23 years you've been here. That must mean you've had a lot of different roles and responsibilities. Am I right?
That is true. I feel like I have been in almost every department we possibly have at some point or another.
Awesome. Yeah. So tell me, what was the first role you kind of stepped into? What did you learn the most, you know, out of that role?
Okay, when I first started here, I was hired in the HANDS program, and that is a first-time home visiting program for first-time parents. And then also we did things like, basically, if you were here and there was work to be done, you helped in it. It didn't matter if it was in your program or not. You know, sometimes we stuffed and mailed letters to tell people about the WIC program. Other times we helped the clerks file their charts. One of my favorite things we did was each fall we had these massive flu clinics that drew hundreds of people. You know, one time I was tasked, my job was to go outside and count people to come into the building because we were at capacity, and the fire marshal was there and said if more than this amount was in the building, they were going to shut us down. And that morning, we gave over 470 vaccines in less than 4 hours.
Wow.
And we have alternative locations for vaccines didn't exist at the time, and we took care of so many in our community, ensure they had a healthy cold and flu season.
Awesome. Yeah, that's awesome. You guys were able to help so many family members. And it's cool that, you were almost to the point where you had to shut down the facility because there were so many people there. Mm-hmm. So to touch a little bit more on hands, a lot of people maybe get confused where hands is different from the helping hands of Greenup County. Can you kind of explain how hands helps the community members of Greenup that's different from helping hands? Absolutely.
The health department has always had some form of a home visitation program for children. When I started in 2002, there had been a program before it called Resource Mothers. And that was a collaboration with a nurse and a nutritionist that went to the health department or went to homes and helped look at the nutrition aspect and the medical needs of children. And then HANDS came about in July of 2002. And what that was, it was specifically geared towards first-time parents and helping provide their babies with the best care possible in the first 2 years of life. And what we did was we would talk about critical childhood development stages, key medical needs such as vaccines, keeping up with doctor's appointments, talking to them about WIC and ways to use their WIC benefits, like even cooking or different things to feed themselves and their children. We talked about breastfeeding, and we served as a sounding board for parenting is hard. Mm-hmm. And a lot of folks, maybe they didn't grow up with having children in their home. So this was a whole first-time thing for them. And we were a liaison for our families and helped them get all the services they needed to have the best childhood experience for their babies as they possibly could.
Yeah, that's awesome. I really do think HANDS is a great program for families in Greenup County. And where you said, first-time parents can be a great resource for them. I think it's also great for parents who maybe have had a little bit of a gap. There's kids maybe spaced out. 16 years has gone by since they've had their last kid, and everything changes so much when it comes to children and toys and formula and breastfeeding. So it's really valuable that that's a resource we have here available for families. So when you talk a little bit about the vaccines, how long have you been involved with the vaccines at the health department?
I always had a little bit of knowledge about it. When I first started here at the health department, I actually wasn't a nurse. I went back and got that degree later. But even though I wasn't a nurse, we didn't have the technology that people could look up about the different vaccines. At that point in time, doctors' offices and other clinics, they didn't have vaccines because you have to purchase your vaccine and keep it as a provider, and that was quite expensive. Mm-hmm. So we were some of the main people that gave vaccines in our community. So we were talking to people about it and teaching them. Like when I first started here, you had a lot of people didn't have their measles, mumps, rubella vaccines. There wasn't a Hep A vaccine really out at that time. So we were just right on the cusp of teaching people what they needed and how they needed to get their vaccines and why it was important. Because where we had had vaccines for so long, a lot of our community really didn't know what those diseases were because you just got a vaccine and you never saw the bad side of it. So that was a good thing. But also sometimes it was a bad thing because they didn't really have any repercussions of what would happen if I didn't get vaccinated.
Right. Yeah, and that's interesting because when you talk about how in the past, there wasn't as much access to, just going on Google and Googling what will this vaccine do or where can I get this. So how do you think the health department kind of marketed the vaccines or helped spread information to the community about the importance of getting these vaccines? How did they do that back in the day?
A lot of it was you had children that were going to school and they weren't vaccinated. So we worked very closely with the school to try to make sure, to maybe provide letters before school started to let people know what they needed for each age. We also talked with the newspaper because that was a thing then. And we did a lot of articles on what was needed. We really, our biggest push was for, our flu vaccines, because we had a lot of really bad flu years there for a while, and trying to reach that out to people. And then we also had people would just call in and ask us, because they would get mailed a letter from the school saying their child was missing vaccines, and they didn't necessarily know. So we would have to help them look it up. And that was also kind of difficult at the time, because we didn't have electronic medical records. You primarily just carried this little card around that you had gotten when your child was born that explained what the vaccines were. So we would, even as a health department, would almost be like a little detective to try to help figure out where people had gotten their vaccines, and we would compile one comprehensive list of what all a person or a child may have had. Because if you didn't have that at the time, we would have to restart people, and that was something we didn't really want to do, because that was unnecessary vaccination.
Yeah, that's interesting. So you guys kept more like a public record of all the vaccines that you could kind of track down in the county. That's interesting. And with the health department preventing sickness with the vaccine side of things, I know they also prevent sickness on the environmental side of things as well. And I know that you had mentioned before, maybe you'd worked some in environmental. Can you tell me a little bit about your experience there?
Yes. When I began my part of the preparedness program, I was housed with environmental. Excuse me. And because I was in that room, I also needed an education on the environmental program, because when our environmentalists were out of the building, people would come in and I needed to be able to answer their questions. And that could be things such as I could collect information. One time I collected a squirrel from somebody so that it could be tested for rabies down the road. But I needed to be able to help try to answer questions and get people in touch with our environmentalists so that we would be able to prevent such things as maybe dirty water in a well, or something that may be happening in a local restaurant that could potentially make people sick, or finding out what they needed to prevent a failing septic system and that possibly contaminating their property. I mean, there's so much with environmental that could really harm people.
And it's interesting you bring up the fact that the water is being tested, because that's actually where public health got its start, was from water, correct?
Absolutely. John Snow back over in Britain with the cholera epidemic. Yes.
But okay, yeah, that's interesting. So with environmental, some of that I know ties in with our emergency preparedness. We work with E911 and Greenup. How does that tie together a little bit?
A lot of what we do, again, with public health, we don't focus so much on an individual person as we do population health. And risks for the population can have far-reaching consequences for everyone. So it works hand in hand with emergency management, because when we first started, we always think diseases and things like that. But natural disasters such as floods, even ice storms, things like that could have so many repercussions for our community. Like, for example, if you don't have power for a long period of time, your freezer could melt, which could make the food go bad, which could cause foodborne illness. Or people being out doing something and they get bit by a dog, which could be something we need to check for rabies. I mean, there's so much that we need to work with. It just makes sense that we work with emergency management to build these partnerships so that we can have a two-pronged approach on how to deliver our prevention messaging.
Yeah, that's very important. You mentioned that especially in the recent years, we've had a couple ice storms that have put people without power for a week or so, even longer. So that's good to mention that, foods in the fridge staying at the temperature danger zone. I think it's 41 degrees to 144. Ish.
It depends upon what meat it is, but yes, 144 to 150 or so, dependent.
Yeah, wanting to keep, because that's where bacteria can grow and really be harmful, especially for elderly or younger populations. So I think it's really important as a health department, we help the community gain awareness to some of that information. So talk to me a little bit about reportable disease. So we've talked a little bit about the sicknesses that we kind of track with the health department. So how do we report these certain things that goes on in our community?
Okay, the health department has a list of diseases and maladies that we keep track of. And again, these are something that it has the potential to harm our entire population. When I first started, again, this is one of these we've talked about how things have changed. We used to have to wait on paper faxes and even sometimes getting things mailed to us. And now we have this, it's an online program called the National Electronic Disease Surveillance System, and we nicknamed it NEDS. And that allows us, along with electronic medical records, to have fast access to disorders and a network of how to gather information. Because what happens with reportable disease is you'll get a report of something, like let's say whooping cough, because we're in that time of year, and we will get a report of that. And as a communicable disease nurse, it's my job to figure out where they got it from and are they at risk of spreading it to others. So then I would get in touch with that family to figure out where they went to see if it spread to anyone else. And we do that for numerous diseases. And sometimes, like if it is in something like a nursing home or a school, we need to work with those facilities to make sure that it hasn't spread into their location, because that's a whole lot of people, and then that can just spread on out, and it makes like a rock going into a pond. Mm-hmm. Those ripples just spread out, and we try to prevent those ripples is the whole point of communicable disease.
Mm-hmm. Yeah, that's very important, especially getting that information so it doesn't spread even more. In your time here at the health department, have you had any reportable disease that has really, has there been any crazy, besides COVID? I guess there's been COVID.
COVID was the biggest one we've ever had, and that one that was all we focused on for 4 years. Now, prior to that, one of the biggest ones that I was actually involved with was a noro outbreak. And norovirus, what it is it's just colloquially the stomach virus that people talk about. And it was something that happened at a regional basketball tournament that had the possibility of exposing almost 2,000 people.
Wow.
And we had patient 0. It was a child that had been sick, and they were a basketball player, and they threw up in a trash can. And when you throw up, that can aerosolize the germs, and that spread out to many, many people. And another one that was very noteworthy was my predecessor. She had an investigation with a hepatitis A outbreak that was linked to a local fast food establishment. And we had these big charts of how we tracked the people, where they went, when did they get sick, what were their job duties that day, to determine who had been at risk on a particular day. Because again, we wanted to stop those ripples, and we were able to keep it down to a few cases when it potentially could have affected hundreds of people.
Wow. Yeah, that's awesome that you guys have done that for so many years and continue to do so to stop that ripple effect. Because not only, I didn't know the aspect of trying to stop it from spreading. I thought it was just you're trying to record how many incidences of the sickness have happened. So I think it's interesting that you're trying to gather information on who was there that day to stop it from spreading even further into our community, because protecting our public health is important here. So
absolutely. And and again, sometimes it's quick and we're able to do that quickly. And sometimes we're really having to investigate to figure out where it all began so that we can put a stop to it.
Wow, yes. And when you mentioned a little bit about COVID, just to bring up all those fun memories again, do you remember the first report of COVID in Greenup County?
Absolutely. That was in the fall. It was a few weeks after Kentucky had its confirmed case, and it felt like the world literally just stopped. And we had to figure out, where had they went? Where were they going? Who had they been in contact with? Because at this point in time, COVID was still a fairly new entity, and we didn't have a 100% idea of how it was spread, what its incubation period was. There were so many questions, and again, where we want to protect the public, we went with the worst case scenario and just tried to just really amp into it. We had a team of 5-6 people that were working with that. And then we were in touch with the state health department and even up to CDC level so that we could try to have this big, imagine a spider web of where all these people were, and we were getting them to where they had gotten that from. And it had been travel and all this, but we were tracking how they came in and where they, like I said, it's interesting, but then it also can be a little bit difficult. I'm very blessed that we do have the electronic capacity that we do now, because if this had happened when I first started working here, we would probably not have been able to have started our prevention measures anywhere near as soon as we were this time.
Wow. Well, yeah, that is a blessing that it's unfortunate that it happened, but it is a blessing that it happened in modern times, so it's a little bit easier for record-keeping purposes, as tough as that time period was. So tell me a little bit about, because I know COVID changed a lot of things in the health world in general. What kind of things did COVID change at the health department? Any noticeable things?
It really showed us the impact of what one person could do. And it also showed us, we were still fairly new at the time to electronic medical records. And we realized the value of being able to do something like that we could get online in our secure databases and see information, whereas before we would have been dependent upon a fax machine or a phone call. So that would have probably, put us a day behind on every single person, if not more so. And it also, again, I wish it had never had happened, but it really increased our relationship with our other healthcare partners, like the hospital, even with the schools, because again, they were trying to operate at the same time. So it helped us increase and strengthen those relationships. And moving forward, we are going to be able to continue to have a quick, comprehensive response.
Yeah, so that's some great information you shared about COVID. It's interesting to hear how over time it really just changed how we communicate with people and how we bond with other organizations. So when thinking about how the reporting and communicating changed in the community, how did you go about getting this health information out? So how did you spread awareness about what was going on with COVID or just about other diseases in general?
When we felt that during COVID, our biggest tool that we had was information, and we wanted to be as transparent as possible, we really relied upon our relationship we had with emergency management. And each day when we came to the health department, we knew that about 3 o'clock, we needed to assemble a report of all the cases that we had each day. And that was sent to our director, who spoke with emergency management, and we had a press release each day. And it didn't tell anything that was individually identifiable, but it allowed our public to know how many cases were occurring each day, if we'd had any deaths, and if there was any particular clusters that they needed to know of, like had it been something that was, again, nursing home related, or something that tied to maybe a specific workplace, so that they would be able to be informed. Our population would be informed of what was going on, because, again, we didn't want to scare people. That was never our intention. But we wanted people to be aware that this is in your backyard and that you do need to be careful, because while COVID, it was not a good disease, most people recovered from it. However, there were some people that didn't, and we wanted people to know that, because we don't want to lose citizens in our community. We want Greenup County to be healthy and be happy and able to live this great life we have. So we wanted to share that so that we could help prevent any future people getting sick.
Right. I think that's a great point, especially with not only COVID health education. How do you think that over time the health department's outreach to the community has changed when it comes to health education? Mm-hmm. So what did that look like in the past? How did it change over time? And how do you continue to do that today?
Health education is one of my biggest loves. And when we first started, you would end up going to places like schools, or you would go to homemakers groups, you go to Kiwanis. We would do public presentations, and it might be on things. It was always varied. We would have maybe smoking, or talking about sexually transmitted infections. We talk about emergency management. We do things like, pet preparedness, just all these different things. And again, we did it group by group. So while we were reaching people, there was still this big population that we weren't. And with time, and again, social media and the internet, all that stuff coming into play, we were able to reach so many more people, and we could use these tools. We were making videos. We were doing reels. I mean, right now we're working on this podcast that could potentially reach thousands of people. We also had email, and believe it or not, there was a time there wasn't really any email available, but we had email that would allow us to restart our newsletter that we have, and we weren't going to be inhibited by direct mailing a hard copy. We were able to email this to folks and send it out, put it on our Facebook pages, on our website, so that it could be shared with so many more people. So our message was going out to an even bigger circle than anything we would ever be able to imagine before.
Mm-hmm. What were some successful ways before internet, email, that kind of thing that you did to get the information out to the community? Was it more so flyer based, or like you said, you went to the schools, that kind of thing? But what about like the working class? How did you get information to?
A lot of that would be like your newsletter. We also would have radio interviews, and they would be maybe focused upon the afternoon commute time. So people who had been working would be able to hear us. We also would have articles in different newsletters. We worked on fostering our relationship with our community partners, because while we had a network of contacts, other agencies like the University of Kentucky Extension Office, they had networks that we were not in direct contact with, so they would be able to share that information with us. So we just used it we kept sharing it out and spreading it that way. But you are correct that where we didn't have the internet so much, we were having to rely upon hard copy communications.
Yeah, and I bet in turn of that, it was probably a little bit more expensive for marketing and that kind of thing, because you have to make those hard copy flyers or to put in the newspaper. I don't know if, certain things like that cost extra money as well. But that's interesting. And I think it's good how times have changed, how it does make it cheaper a little bit for us in the health department side of things to broadcast to more people in a somewhat simpler way.
And also with time, I feel that our responsibility to share information has increased because our health department is a subject matter expert, and our job and responsibility is to provide accurate information in a way that people understand you. Because so many times you might hear something, but you don't understand what was said to you. So we want to be able to, again, share it in an approachable way so people are informed. And when people are informed, they're not afraid.
Yes, I think the health department has really done a good job in the last few years, especially to getting that information to the public about what we do here in the services. And we'll talk about that a little bit more next time when we talk about the future of public health too and what we plan on doing. But out of all the roles you've had, which one taught you the most about public health?
You know, to really think on that, I don't know if I could pull one role out and say that was the most important one, because each one has taught me something, and it showed me different facets of public health. And I credit all of them to making me so well-rounded in my public health education. You know, public health touches nearly every aspect of life. And we here at the Greenup County Health Department, you know, we're integral to improving and maintaining the health of our community. So I feel that my entire 23 years has brought me to this point that I feel that I'm really able to help people.
Wow. Yeah, that's awesome. And it's good to have you, a team member who is so valuable in all of these roles and aspects that you've held, to still be wanting to be at that forefront of helping the community. And, you know, that's what drives us here at the health department. And I hope that the community, you know, as we continue this podcast, begins to understand that more, as we're here as community support. And yes, we've done things different over the years, but we are trying to evolve and change with the community itself. So I think that's awesome that each role taught you a different aspect of public health, because there are so many different channels to public health that people don't even realize. I mean, when I was first interviewed here, I thought the health department only did vaccines and septic tank inspections. And as a dietitian coming to a health department, I'd never heard of a dietitian even working at a health department. So it's just been really interesting learning about everything that the health department has previously done and what we continue to do to learn and grow every day. So, from your perspective, how would you describe public health today compared to 23 years ago? And what do you hope to see for our health department in the future?
When I think about public health, two words come to mind, and they are adaptable and resilient. No matter what we're presented with, we meet challenges head on, and we work our hardest to protect the community we live and work within. We embrace technology and foster relationships with our community partners to ensure this little corner of the world is safe, educated, and healthy. My true hope is that we will continue to provide this for generations to come. I feel we have the best staff, and we all have servant hearts. We all want to see our community prosper and grow and be the healthiest people that they can be.
Well, thank you, Cassie. That's awesome. I really appreciate you being the first guest on the Healthy Department and having such good insight to the past 23 years in Greenup County. Thank you so much.
Thank you. It's been a pleasure.